Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder here, and we're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. We're select there. And right now we're going to put in our shaver just to trim some of this labrum here. We're going to be doing a biceps tenodesis as well. Okay, so we've trimmed the labrum. You can see why we're going to have to do a tenodesis. This is very loose, and this is what we call kind of a degenerative slap tear. Your rotator cuff tear is up above here. So as we rotate the camera and look up, this is where the rotator cuff is right here. And so right now my shaver is right at the footprint. This is where the tendon normally inserts right into the bone here. And we can see right where this area is, right where the tear is. So we'll keep your systolic down to under 100, and that'll help control our bleeding here a little bit. But right now we were getting a really good look at this torn rotator cuff. We're doing a little bit of work from this articular side because often this is our best view. Hit the pressure up, please. And awesome. And we know from the MRI that your biceps is torn too. And look, sure enough, as we look, you can see that split in the biceps tendon. Okay. And so as we tug down, we can see that that biceps is split and not great. So what we're going to do is we're going to secure it. I'll show you how we do that in a minute. Pause. Okay, so now we're going to take our spinal needle, and in just a second you'll see that pass through the tendon. And again, this is just going to be a retention suture. You can see that going through right there. We'll go ahead and take our shuttle relay, and in a second we'll take our free suture. Do we have our free hi-fi suture? Hold the camera, please. I need a grasper. Okay.
On the shelf.
Okay, and so we're going to go ahead and retrieve the relay here, and I will load the suture in just a second. Okay, so now we're passing through the biceps tendon a second time. We have a little trick here, how we make this suture stronger, and again, this is really just to give us the ability to hold on to this tendon and do a tenodesis. We're likely going to be doing an arthroscopic tenodesis, what we call a suprapectoral tenodesis. We'll take a grasper here. And now here's the trick. We'll pull a bunch of this in first. And now we're going to back the needle out. But instead of just taking this straight out through the cannula, we're going to sneak around behind the biceps now to retrieve it. And so now we're going to pull it out this way, and we'll show you what that does for us in just a minute here. We're going to load it. We'll pull back. There you can see it going through, and we've purposely gone pretty high up in the interval. And now we have, here you go, careful there. Now we have a good bite of that biceps. You can see as I pull tight that that's really got that biceps snug down. We're going to go ahead and take a pair of arthroscopic scissors next and do a tenotomy. And then after that, we'll have another look around the joint. Okay, so now we're going to go ahead and release the biceps well below our securing stitch. just like that. And now with our shaver, we can clean some things up around the joint here. We don't want to leave the stump if it's going to cause problems. That's pretty small, though. I'm pretty happy with that. We saw some arthritis as we look down below. We'll show you some of that chondral degeneration in just a minute. This is back up working on the footprint of the rotator cuff. What's my pressure on? Okay. Please don't grab anything when I'm doing this. Okay, so we'll show you some more in just a minute. Pause. Okay, so now we're looking in the back of the shoulder. This looks pretty good. You can see some of the wear and tear changes in the glenoid right here. And then this is where we were working on the biceps anchor. Now that we have that secured, there's nothing really else to do inside the joint. So we're going to stop here and get to work on the rotator cuff and on the biceps from the superior aspect of it. We'll show you that in just a minute. Okay, so we've cleaned things up and identified the tear. I think it's pretty obvious now. You can see the hole in the tendon. That's the biceps over there. Let me see a grasper. And we're going to be separating the rotator cuff repair from the biceps tenodesis, and we'll use a second anchor for the biceps. I just want to show you what I'm talking about. So there's the biceps. You can see our little retention sutures there. But we know our tension because of that, and we know we're going to be placing the biceps down. Basically, we're going to be placing an anchor right in the groove right there, or right next to it, just to hold that biceps in position. So I'm happy with that. The next step for us is going to be to plan this rotator cuff repair, and we'll get to work on that. Okay, so now we're just planning the repair. This is going to be the posterior anchor. These anchors are going to be placed in a single row. They're triple loaded. We're going to place the first one down right about here. And we'll show you that in a little bit. Okay, here's where we've made the first hole in the bone. We're going to place our corkscrew anchor down in. Okay, so here's our anchor down in the bone. You can see it's just a couple of millimeters off the articular margin here. We've got 3 different colored sutures. We're going to work with the most posterior suture first. We're going to use a straight, what we call a straight suture hook. It's really a crescent-shaped suture hook. We'll pull out this suture first. Okay, grasper to me. Okay, here's what the suture hook looks like. It's loaded with a kind of a coated wire called a super shuttle. And basically, we're going to come in posterior right back here. Okay, hold the camera there, please. We're going to use a grasper from the left side of the screen to help, and also to make sure that we're getting all the way underneath. That looks like a pretty good shot there, so we'll feed that through. Okay, hold the camera. Okay, so now we're going to go ahead and pass another stitch. You can see the first one, we haven't tied it yet, it's over there. We'll control the bleeding a little bit, also give you a better picture. Our second stitch, we're going to bring this down right about here. Okay, pause, long push. Okay, so we haven't tied any of the rotator cuff sutures because we wanted to leave space to do this biceps tenodesis where we could still see it. So you can see our marker, our retention suture, has a pretty good hold on the biceps. You can see that. You can see how we have your arm fully extended, your elbows fully extended, and you're pronated, so we know that our tension's pretty good here if we get you down about here. So what we're going to do is free up a little bit more of the soft tissue right in the groove. I think that's going to be enough. Okay, so I'm going to give you a picture. You can see we're placing an anchor down right at the high point of the groove. We're going to tap this down a little bit. We'll show you some more in just a second. Okay, so now we're going to start to screw this down into the bone. A very hard bone. That looks great. Okay, you can see how we've cut the retention sutures. We've passed kind of a locking stitch through the biceps once. We've got one more suture from this swivel lock, and we'll get that passed right now. But you can see how we're going to tighten that down right there. Okay, so here you can see our two sutures lined up. Looks very nice. As we rotate your shoulder, you can see how that's going to be great. Now, if we had a really big tear, we could even bring more of the biceps in or release it and use it as part of our repair, but that's not necessary here. But that biceps tenodesis there looks very solid. I'm happy with the way that looks. We're going to go ahead and trim down a little bit of the edge that we don't need anymore here. Okay, and I'm happy with the way that looks. Now we're going to get to work on tying these rotator cuff sutures, and then we'll be done. Okay, so I think we're all done here. You can see the sutures from the rotator cuff. Hold this right here like that. And as we rotate the shoulder, I think it'll be a little bit easier to tell what's going on here. Okay, so we've got 3 sutures from that anchor. There's 1, 2, 3. Our biceps tenodesis is right there, and that looks good. And I think we're all done here. Okay, I'm happy with the way that looks. We're going to get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.